The Republicans view the Affordable Care Act as probably the worst evil vested on mankind since the dawn of time, and the Democrats view it as some kind of perfect product of immaculate conception. And so there's not really a lot of room for a conversation given those two disparate views.
Healthcare is very segmented and siloed. I think we can all agree on that. When you go to a conference like this, you're going to get multiple different perspectives. And I think it makes for a good conversation.
We tend to spend all of our time with the tribe that belongs to our particular silo. We work in mental health, we see mental health people, we see them all the time. We may not be talking to the telemedicine people who are over here. The genius of state of reforms design is putting all those people in a room around common conversations and getting them to connect and network and share ideas.
How do we make it work so that it's beneficial for the provider, it's beneficial for the payer, and that the outcomes for the individual are quality and they're receiving the services they need?
Be bold and not settle for the status quo, and really look at bold new ways of thinking and really get out of their box and look at new ways and best practices, not only in Texas, but across the United States and across the world in healthcare.
We've had local providers understanding their local communities and what they need in order to provide better health care.
It's nice to hear mental health care, substance use care being discussed in the context of general health care. So I think this has just been one of the best uses of my time in the last few months. Could not be happier being here.
These are big problems, and they're going to take all of us working together. It's very important that voices are heard, and that's where we do get the ideas. The world is in a very different place, and while it is great to have experience and kind of know some things, it's really good to kind of pull back and take a fresh look at things.